Hello, my name is Jackie Redmer, and I'm an Integrative Medicine Fellow in the UW Department of Family Medicine. I'm going to talk with you today about how to approach weight management with your patients using an integrative medicine perspective. As many of you know, over the past 20 years, there has been a dramatic increase in obesity in the United States, and rates remain high. According to the CDC, approximately 1/3 of U.S. adults and 17% of children and adolescents are obese. This module focuses on the weight management of adults. The disease burden associated with obesity is high. Obesity in adulthood is also associated with a striking reduction in life expectancy for both men and women. Obesity is an independent risk factor for the development of several chronic diseases, including diabetes, hypertension, dyslipidemia, gout, heart disease, stroke, dementia, GERD, osteoarthritis, cancer, kidney disease, urinary incontinence, and depression. Other reports have found higher disability and healthcare expenditures for patients who are overweight and obese. The etiology of obesity is multifactorial, including genetic, psychosocial, behavioral, and environmental factors, and as such, patients benefit from holistic treatment. Obesity is a chronic relapsing disease requiring a lifetime of prevention, treatment, and maintenance. Primary care physicians generally agree that treatment of weight problems should be within their scope of practice. However, many cite lack of time, training, teaching materials, staff support, and adequate reimbursement as common reasons they fail to address these important issues more often in clinical practice. However, many studies show that the vast majority of patients are willing and even eager to discuss weight with their current primary care physicians. In the traditional approach to weight management, discussions usually focus on diet and exercise only. An integrative medicine approach addresses lifestyle changes in all areas of the human domain, including nutrition, physical activity, supplements and herbs, stress reduction, manual medicine, sleep, and spirituality. Integrative medicine also addresses the practice of mindful eating, which helps patients radically change their relationship with food and identify emotional triggers for eating in addition to hunger. Counseling patients on proper nutrition for weight management is more than just discussing calorie restrictions and dieting. Planning for weight management is also a good time to discuss the principles of a diet which supports health promotion and disease prevention. Healthcare providers should identify the principles they want to convey to their patients about a healthy diet. This is the top 10 list I have created. There are dozens of diets available to promote weight loss. In general, most diets work because there is an overall reduction in daily intake in calories. Some diets work better for some patients, however. For example, a low-carbohydrate diet might be helpful for someone with insulin resistance, while a low-fat diet might be helpful for someone with lipid disorders. A dietitian can help patients determine which diet is best for them. Examples of a low-carbohydrate diet include the Atkins and South Beach diets, while the Ornish diet is a low-fat diet. The Zone diet and Weight Watchers are considered balanced diets. The key to using diets successfully is to let the principles guide healthy food choices that will sustain weight loss in the long term. Any healthy eating plan should try and incorporate the principles of the anti-inflammatory diet. This diet helps reduce inflammation in the body. A number of medical conditions are linked to too much inflammation in the body, including heart disease, stroke, cancer, asthma, type 2 diabetes, chronic pain, inflammatory bowel disease, and Alzheimer's disease. Food intake recording and regular weigh-ins were both identified as important aspects of weight loss planning and maintenance by successful members of the National Weight Control Registry. Physical activity should be part of any comprehensive weight loss therapy and weight control program. Engaging in activity at least 150 minutes per week ensures health and fitness benefits, but this amount might not be adequate for weight loss. According to the National Weight Control Registry, a person in ongoing weight loss needs to exercise for approximately 60 minutes per day, expending an additional 400 calories daily. Maintenance of weight loss requires 60 to 90 minutes of exercise per day. Small changes in physical activity can also have significant impact over time. These can include walking or biking for transportation, parking further away from an entrance, and taking the stairs when possible. Some people find it helpful to use a pedometer or a device that counts each step a person takes. Although 10,000 steps per day, or 5 miles, is recommended by some to be the benchmark for a healthy lifestyle, individual goals can also be set. There are dozens of supplements that are marketed for weight loss. Their effects can be organized into 3 general categories: appetite suppressants, thermogenic agents, and digestion inhibitors. Few weight loss supplements, however, have demonstrated both effectiveness and safety in clinical trials. Both fiber supplementation and green tea are safe, however, and have shown some benefit. These could be recommended to patients attempting weight loss because of their additional health effects. Stress management and the mind-body relationship with food is an important but overlooked part of weight loss planning. The stress response in the body involves metabolic changes that increase abdominal adiposity and insulin resistance. Stress may also affect food choice, both through lack of time for food preparation and by increasing preferences for high-fat, energy-dense foods. Stress has also been shown to reduce participation in leisure time physical activity. Behavioral interventions, including motivational interviewing and cognitive behavioral therapy, should be included with any treatment plan. And this is particularly true for any individual in which active mental health issues affect their eating activity. Eating patterns can also contribute significantly to the progression of obesity and must be addressed as part of any weight loss plan. The practice of mindfulness is not only useful for stress reduction, but has also shown promise as an adjunct treatment for those desiring weight loss. Through meditation and yoga, patients often develop an increased awareness of their bodies, including the feeling of satiety as well as non-hunger reasons for eating. With mindful eating, we practice taking control of what we put in our bodies and getting pleasure from the foods we choose. There is also available but limited evidence that hypnosis and acupuncture might be helpful adjunct treatments for weight loss. Both epidemiologic and clinical studies have shown that short sleep duration is consistently associated with the development of obesity in children and adults. Consecutive sleep restriction, or sleeping less than 4 hours per night, elevates the sympathetic nervous system and increases evening cortisol production, which has been shown to increase food intake and the accumulation of abdominal fat. Sleep restriction is also associated with lower levels of leptin, the hormone responsible for food storage, and higher levels of ghrelin, the hormone that stimulates hunger. Compared to individuals who work during the day, shift workers are at a higher risk of a range of metabolic disorders and diseases, including obesity. There is increasing evidence that circadian desynchronizations, like shift work, may affect energy metabolism and weight regulation. In light of this information, patients should be advised to 1. Limit shift work when possible. 2. Adopt regular bedtime routines, which mimic the natural circadian rhythms of the body and allow for 7 to 8 hours of sleep. 3. Limit nighttime eating. 4. Eat regular meals. And 5. Eat breakfast. Clinicians should assist patients who want or need to lose weight by helping them to create a plan for weight management. Motivational interviewing and a stages of change assessment tool is helpful to guide a treatment plan. Draw on the patient's own motivation to change as well as their own resources. If a provider does not have the time or resources to create a weight loss plan, they should refer patients to a dietitian, an exercise physiologist, health psychologist, life coach, health educator, or colleague skilled in an integrative approach to weight management. Thank you.